Hello everyone, my name is Ogunleye Fadekemi and welcome to today's episode of Sagelife Health Podcast. Sagelife Health Podcast is a production of Sagelife Laboratories and it speaks on the prevailing health issues that plague us as a country and the role preventive medicine plays in order to ensure a good state of our health. Today we have put together for you an informative and educative episode. So sit back, relax, unlearn and relearn. Welcome back. Before the break, we were talking about how the podcast focuses on the prevailing health issues we face as a community and the country as a whole, and the role preventive medicine plays in ensuring that we maintain a good state in our health and also increase or boost our life expectancy. For this episode, we're going to be focusing on an internal organ known as the kidneys. Why the kidney? Well, the 10th of March is celebrated as World Kidney Day. So in order to commemorate that, we put this episode together for you. I have an expert here who is going to be our guest for today's show, and she's going to be speaking on the general concepts about the kidney, give us a general overview, and debunk some of the myths concerning kidney diseases. She's a seasoned professional and has practiced medicine for over 10 years. With me here, I have Dr. Chika Nwokolo. Welcome.
Thank you, Ms. Fadeke. It's a pleasure joining this podcast.
The pleasure is ours.
Okay, we are talking about the kidney today.
Yes.
And we all know everyone has two kidneys.
Okay.
Occasionally, some people are born with one kidney. From birth, they have one kidney.
Oh, that's new.
Yes. Some people have one kidney from birth, but basically, a greater proportion of people have two kidneys.
Right.
So your kidneys are in your abdomen, but towards the back of your abdomen, just along the spine. And yes, so the functions of a kidney are basically what people know that the kidney does is to remove waste products and toxins from your blood and excrete it. And
so it does more than that?
Yes, it does
wow.
more than
Okay.
that. So I'll just list a few other things that the kidney does. It helps to regulate your water balance in your body, takes away the excess water, and then helps you retain more water when you have drank less water during the day.
Wow.
Another thing your kidney does is to regulate your blood pressure. And
that's new.
yes. So another thing the kidney does again is to help your blood level. So the kidney produces a hormone, and this hormone helps to stimulate your bone marrow to produce more red blood cells.
Okay.
And we know the red blood cells is part of your blood, and so that helps you to
so the kidney is a powerhouse, basically.
Yes, a powerhouse. It also helps in your calcium and vitamin D balance. So if you have a problem with your kidney, most times people come down with bone pains and calcium disorders. So that's some things your kidney does. Yeah. So how do you know you have kidney disease? Okay. Usually people on the early stage of kidney disease, people complain that when I go to pee in the toilet, my urine is foamy, and then they think it's normal, but it's not normal to have foamy urine.
Wow, so that's like the first thing we should watch out for.
Yes, so when you use the restroom and then you notice that your urine is foaming, that's the cue for you to go to your doctor immediately to make a complaint.
Okay.
Another thing that you can notice in your kidney is that you start having blood in urine. It may not be too red, but the color of the urine darkens. It becomes like coke colored.
Wow.
Yes. So so people with kidney disease also experience that. Another thing that people with kidney disease have is that when they wake up in the morning, sometimes their face looks a little bit swollen. The whole face, not only the eyes, so the whole face, and also your feet too. You wake up, you see your swollen feet, facial puffiness becomes a bit swollen. So that's your cue to go to the doctor to say something's going on wrong.
Okay, so Dr. Chika, I put it to you: can kidney disease be cured?
So, like with all diseases, early detection is very, very,
very important.
Very important.
Very, very important.
The kidney, before it goes to the end stage where people hear, okay, this person is on dialysis, it goes dialysis,
which is all we actually hear.
Yes,
you don't say, oh, someone has kidney disease and he's already on dialysis.
Yes. That person has gone through phases of kidney failure. unknown to
the person.
Unknown to him or her.
Wow.
So the normal kidney function stage is at stage 1, and the one where people need dialysis is usually stage 5. So there's
they
stage 2,
like 4 stages without even realizing.
Exactly. So when you notice the frothy urine, the blood in urine, you could probably in the stage 2 or stage 3. And if well attended to, you could stop the progression from the stage 3 and then live for the rest of your life on that stage 3 and not need dialysis in the long run. So at that point, the kidney disease was arrested and halted from progressing. So it's actually treatable when you get early detection.
Okay, so from my little understanding, I'm not a professional. I know preventive medicine helps to, since you said that kidney disease can't be cured or prevented now. So that means there's a major role preventive medicine plays. Does it go in the form of like regular yearly checkups or what? I mean, help us please.
Okay. So the checkups for kidney disease are very cheap, and almost every lab and does it. Even you do a urinalysis and you do a kidney function. And from there, if you don't have any disease noticed during this test, you could do it on a yearly basis. But when a disease is noticed, they can tell you do it every 3 months, do it every 6 months, and down the line. Also, for people that are born with kidney disease, they may need to do an ultrasound of their kidneys to know whether they have 1 kidneys, 2 kidneys, or whether the kidney is shrunken, whether it's a little bit enlarged. So an ultrasound scan can do that of your abdomen, can do that for you.
Also, is there a particular age that is susceptible to kidney diseases?
The age for kidney disease, basically, with the prevalence of hypertension these days, a lot of people, before hypertension was a disease past the middle age.
Dr. Lagos is stressful.
Yes, I understand. Yes, stressful. So hypertension, we are seeing hypertension these days in earlier ages, from 20s. So people that have early onset of hypertension and maybe diabetes usually have kidney disease earlier, maybe by their 40s or late 30s. So the trend has changed. Initially, it used to be from 50s to 60s, but it's moving upwards now to the 40s and early 30s. This is people that have acquired kidney disease. The other form, when I mean acquired, that means they were not born with it. So the other people are people with kidney disease that were born with it. So those ones you receive less than 5. When they're under 5 years of age, you will notice that their kidneys have abnormal functions, or maybe under 10. So those ones are usually born, or maybe they inherited some kidney condition. So the age depends on whether the person is born with it or whether the person acquired it from lifestyle.
So 2 questions. I know you're very busy. One is, can kidney disease be contagious? I mean, if someone has it and I go close to the person, can I get it? And then lastly, is it something that can be passed from generation to generation? Like, so for example, if you're going to have a baby now, you're asked if your family has history of hypertension, because I think it's passed through your DNA code, if I'm saying it well. So is kidney disease in those forms?
So first of all, kidney disease, like I said, the congenital ones, the one people are born with, most if it's the congenital ones or through the gene link, it can be passed through the genes. From, like example, you have the adult polycystic kidney disease. Those ones, they have a higher tendency. If the person's parents had the kidney, then the kids will most likely be susceptible. And also, like I said, kidney disease is not transmissible. You can't get it from being with someone or living with someone. So that's it.
All right, thank you so much for your time. We really appreciate it. We'll take a break, and when we come back, we would have a specialist speak to us about all we need to know on kidney diseases and kidney conditions. Quick fact: did you know that a doctor that treats kidney conditions is called a nephrologist? Well, stay tuned. When we come back, we'll have an expert nephrologist speak to us on kidney conditions, kidney diseases, and kidney care.
Right, thank you for this opportunity. My name is Dr. Theophilus Umeizudike. I'm a consultant nephrologist and also a transplant physician. I work at the Lagos State University Teaching Hospital, Ikeja, and I also consult at the Nephrocare Medical Services at Okpebi. So basically, this year's World Kidney Day is captioned kind of reducing the gap and breaking the knowledge gap that patients and caregivers have about kidney disease. So it's essentially to help them know more about what kidney disease entails and the need for them to be part of caring for their patients or their relations, and also to make them see the things that they need to know so that they are not in the dark or uninformed about kidney disease. So we'll just look at the kidneys, what they do in the body, and some diseases of the kidneys. And so basically what the kidneys do in the body is that the kidneys are able to, there are two bean-shaped structure about the size of a fist, if you make a fist, and then they're able to essentially ensure that the waste products that the body generates from metabolism is removed through the urine. So they remove the nitrogenous waste products, which we can measure in the blood as creatinine and urea. And they're also able to regulate body water. They also regulate the sodium, the pH of the body, and they're also able to produce some hormones like the erythropoietin and the calcitriol, which maintains bone health, while erythropoietin makes sure that your bone marrow is able to produce enough blood. So these are some of the various functions that the kidneys perform on a daily basis. So I just want to give you a clue to how efficient that God has made your two kidneys to be. So most people, over 99% of people, have two kidneys. Very few number of people may have been born with one kidney. So it stands to reason that those two kidneys are performing excellently well, and that's why you're healthy. You don't think about urinating. Some people even wake up at night to urinate. So the urine that comes from the kidneys is what is the waste that you get rid of from your body. All right, so most people need to take in about 2.5 to 3 liters of water to be able to generate about 1.5 to 2 liters of urine on a daily basis. And if you look at what the amount of blood that goes through the kidneys, it's quite enormous. But out of that volume that goes through the kidneys, the body is able to remove, out of, let's say, about 120 liters, the body forms about 2 liters of urine from that huge volume that goes through the kidneys. Shows how efficient the kidneys are and how God has made it to be so efficient. The other thing I want to talk about is that when kidney disease occurs, in the earliest form, it's usually very symptomatic, just like we talk about hypertension as being a silent killer. So chronic kidney disease can also be looked as a silent killer, because in the early forms, you don't have symptoms, or the person doesn't exhibit any symptom. And some of the ways that we can screen to know whether someone has a kidney disease is to check the person's blood pressure. So high blood pressure may be connected to kidney disease. Just like if somebody has kidney disease, they may eventually develop high blood pressure. At the same time, if you check someone's blood sugar and the person is diabetic, that is another risk factor for someone to develop kidney disease. So diabetes, whether it's type 1 or type 2 or any other type of diabetes, is a strong risk factor for someone developing kidney disease. And in the developed climes, diabetes actually accounts for over 40 to 50% of those coming down with kidney problem in their lifetime. In our climb, the number one cause of chronic kidney disease is actually hypertension and chronic glomerulonephritis. Chronic glomerulonephritis is a word or a term that is used to describe many infections and inflammation that occurs in the kidneys over months and years, that ultimately leads to stage 5 of kidney disease, when the person will be needing dialysis or a kidney transplant. So we can classify kidney disease into 5 stages, starting with stage 1, when the overall kidney function is about 90. Stage 2, when it's between 60 and 89. Stage 3, when it's between 30 and 59. And stage 4, when it's between 15 and 29. And stage 5 is when it's less than 15. So basically, when the kidney function falls to below 60, that's when many of the symptoms begin to manifest. And those symptoms could be like tiredness. Somebody feels tired, takes a little walk and he feels tired, or is not able to climb the stairs. Or then also it can also manifest as people not being able to sleep. And then sometimes it can manifest as someone having lots of foam when they pass urine. It also manifests as people finding blood when they urinate, or waking up in the middle of the night over 3 or 4 times urinate. But I must make a distinction that for that to happen, that is waking up overnight, the person shouldn't have had much water in the evenings or at bedtime. Because if you drink water at bedtime or in the evenings, then you are prone to waking up to urinate. So those are some of the symptoms. Of course, in the late stage of chronic kidney disease, stage 5, the person will be vomiting, have poor appetite, have frequent hiccups, can have abdominal pains, can have body itch. Sometimes their legs are swollen, or they can have what we call pulmonary edema. That's lots of fluid in their lungs. They can also have a cough. They can also have, they get filled up easily. Some people can present in coma. We've had people come in coma and you think they have a stroke. By the time you run their kidney function, it's hitting the roof. So those are the symptoms and the things that we'll find. So how do we screen for kidney disease? The easiest way to screen for kidney disease is to check a few parameters, which will not be very expensive. So one of the easiest way is to do a urine test. By the time you're doing a urine test and you're checking for protein, protein is one of the strongest indicators of early kidney damage. So when there's kidney damage, it manifests as protein. It can also manifest as blood in the urine. So you can check for those things by doing a simple urinalysis and urine microscopy. At the same time, you also want to do a blood pressure check. So a blood pressure of 140/90 and above is synonymous with hypertension when it's been checked more than once and is consistently elevated above that level. But I need to also remind us that when you're using the home monitor, the cutoff is a bit lower. It comes down to 135/85. So when you have a blood pressure using the electronic meters to check and it's 135/85 and above, that is hypertension. Okay, so that's another way to screen for kidney disease. Now, by the time you're also doing a blood sugar and the blood sugar is high and the person has diabetes, people that have diabetes are at risk of having kidney disease. Then there are things you want to check for is blood cholesterol. When you check the blood cholesterol and it's high, so that may be an indication that this person may have kidney disease. And then you also want to check the serum albumin. You want to check the liver function test. You want to also check the abdominal scan of the person and look at the size of the kidneys and how they look on ultrasound scan. So that can indicate that this person's kidneys are normal size or enlarged. And so some things that you can also find by scan is a condition described as autosomal dominant polycystic kidney disease, which is usually diagnosed in people who are in their 30s and 40s, and these people begin to form cysts in their kidneys, and with time their kidneys shut down and they will need dialysis and ultimately transplant. So those are some of the tests you want to do. Of course, there are other things that can be screened for in somebody that you think may have kidney disease, or you want to screen to see whether the person has this as a cause of kidney disease. So you want to look at people who have sickle cell. Sicklers can be at risk of developing kidney problem, and also people who have hepatitis B, hepatitis C, and of course HIV virus. Any of these viruses can be a precursor to kidney disease, because those viruses have been known not just to affect the liver or other organs, but to cause definite types of kidney disease. Of course, in women, we have a condition that we describe as autoimmune diseases, which becomes like the body fighting itself. So the body develops antibodies that fight the kidneys and other organs, and this is particularly about 9 times commoner in women than in men. So women in their reproductive age group are particularly prone to SLE and other connective tissue disorders. So women should, especially when they are at that age and they notice something like high blood pressure or have hypertension during pregnancy, they should be screened for this condition, because that may be an indication that they have an autoimmune disease that is affecting their kidneys and can affect their pregnancies. This can also be a cause of infertility in women, which we need to be treated, and ultimately it's treatable, and then it can also cause kidney disease. Then of course, conditions like kidney stone, which is common in our environments because of the fact that we have a very hot environment that makes people sweat and lose water from their skin, and they don't take enough water. And when you don't take enough water, you're at risk of developing kidney stones. So kidney stones that comes frequently and leads to urinary tract infection can actually be a precursor to someone developing kidney disease. And then in men who have prostate hypertrophy or prostate cancer, it can block the urinary tract and cause what we call obstructive nephropathy that can lead to kidney disease, or chronic kidney disease rather. And also for women, they may have an ovarian malignancy or carcinoma of the cervix, which can block the urine outflow from the bladder and eventually lead to chronic kidney disease. So those are some of the things that can actually cause kidney disease that I've enumerated. So we'll look at the treatment. How do you treat? Now, if you look at all these causes, many of them are potentially treatable. So hypertension, people who have hypertension should be treated. Drug treatment with antihypertensives. People often ask, how long are they going to be on this treatment? The thing is, if you look at the fact that when hypertension occurs, the body has reset that blood pressure to a higher level. And when the blood pressure is at a higher level, there's a risk of not just kidney disease, there's a risk of stroke, there's a risk of heart failure, there's a risk of heart attack, there's a risk of blindness. So with all these risks, it's better you take those medications for a lifetime. You take them every day. And you also need to be monitored to be sure that the blood pressure is well controlled. So we usually talk about good control. So some studies have shown that up to 20 to 40% of Nigerians have hypertension. If you extrapolate that to the whole population, that is quite alarming. That's close to 30% of Nigerians. And if we have a population of 200 million, you're talking of over 60 million people having hypertension, which is quite alarming. But the thing again is that in many places where hypertension has been studied, so you have a rule of thirds. 1/3 of people are diagnosed to be hypertensive. 1/3 of that are just on treatment. And you also just have 1/3 who are even controlled. So many people are not taking their medications. Many people are not controlled. And that's why you have high mortality. You have hypertension being the number one cause of cardiovascular disease and a leading cause of mortality in our incline as well as worldwide. So treating hypertension is very key to preventing kidney disease and other cardiovascular diseases like hypertension, heart attack, and heart failure. So we need to treat hypertension, and apart from taking medications, the other non-pharmacological treatments will include reducing salt intake in meals and making sure that people don't add extra salt to their meals. And then you do your exercise. It's recommended that you do 30 minutes every day or 5 days in a week. And then you take your fruits and vegetables. By the time you're doing all this non-pharmacological therapy alongside with the medications, the blood pressure more often than none will be better controlled than putting you at risk of all the complications I mentioned. So the other leading cause of kidney disease is diabetes mellitus. which can be diagnosed by doing a fasting sugar, psoas, postprandial, and glycated hemoglobin. And when these are done and the person is found to be diabetic, it can be treated with medications as well as non-drug therapy. And then we talk about being able to diagnose other things that I talked about, like those who are sickles should be screened for kidney problem. Those who have HIV, hepatitis B or C, alongside with their medications for those viruses, should also be screened for kidney disease. Those who have a family history also of kidney disease, maybe a first degree relative or a second degree relative has been diagnosed with either hypertension, diabetes, or even someone has had dialysis or has had a kidney transplant, should be screened for all these risks that I talked about. Now, there is this thing I want to come to now, which is becoming topical in the last 10 years, the role of genetics in predisposing blacks to kidney disease. So a study that was done in the US showed that there's a gene which is called apolipoprotein 1 that has been shown to predispose people of African descent to kidney disease. So that genetic mapping has been done among Nigerians in the northern parts, southern parts, southwest and southeast. And southwest and southeast have quite a number of people from those climes who have this APO1 gene. And APO1 gene was a mutation that happened about the time of the slave trade, okay, or just before then. And so many of the black people who lived then were predisposed to sleeping sickness, that's trypanosomiasis. So this gene came about to prevent people from developing that disease. However, in our time and in our day, that gene mutation that occurred about that time has now been shown to predispose African Americans or people from sub-Saharan Africa to have kidney disease. So, apolipoprotein 1 gene is actually quite topical now, and courtesy of some NIH funded study in Nigeria, in Ghana, and some other African countries, there's an ongoing study to look at the role of this APO1 gene in causing kidney disease among sub-Saharan African population. So how do we treat kidney disease? Well, the options of treatment are a few. There is the option of conservative management, in which you just treat the symptoms. You don't really intervene much. There's option of doing dialysis, which can be as peritoneal dialysis, in which fluid is introduced into the abdomen, stays for some hours and is exchanged. And there's the option of hemodialysis, which can be in-center or home hemodialysis. Okay, so the mode of action of hemodialysis, which is what is prevalent in Nigeria, is to make sure that is to actually use what we call a extracorporeal circuit through which the blood flows and goes through what we call the dialyzer and the dialyzer membrane. And in the process of treating the person for about 3 to 4 hours, there's some exchange between the person's blood and the dialysates. So at the end of the treatment, the dialyzer is able to remove most of the wastes that the kidneys of that patient is unable to take care of. So that should be done about 2-3 times a week. And such people who need this chronic dialysis will ultimately go on to have what we call the third option of treatment, which is a kidney transplant. And kidney transplant, thankfully, is available in many centers in Nigeria. And it basically involves someone being a donor for the person who needs the kidney, who has chronic kidney disease stage 5. And once it's established that this person needs a transplant, it's for the person who is coming up as a donor to be medically fit, be free of all the risk factors we talked about earlier on, be free of hypertension and diabetes, be free of HIV, Hep B and hepatitis C infections, and of course the person will also be screened to be sure he has 2 kidneys. And with that, we can be able to go on and give the person a transplant. Right? So in a nutshell, I've tried to look at kidney disease, define the kidneys and their function, symptoms that herald early forms of kidney disease, which quite often are asymptomatic, and then I talked about the treatment and the risk factors. And in closing, I'll just say that the kidneys are quite amazing, and we need to take what I call give yourself a birthday gift. So as an adult and as a young man or a woman, you should make it a duty that at least once a year, maybe at the time of your birthday, you give yourself a birthday gift. Do a screen for your health, okay? Make sure you include a urine check to check your kidneys, apart from blood pressure, blood sugar, and all the other checks, okay? And then make sure you consume reasonable amount of water in a day to make sure your kidneys are cleansed. I mean, people talk about cleansing treatment. Taking water about 2.2 to 3 liters per day can just be good enough and healthy enough to keep your bodily system cleansed from all forms of toxins. All right, and then make sure you don't add extra salt to your meal. Of course, I didn't mention this in my presentation. Herbal remedies may not be so good, even though they claim all sorts and claim all kinds of things that they can perform. But make sure that you also don't indulge in taking some over-the-counter prescriptions, even those that are used for ulcer treatment. You need to be careful about them, and also for those that are used for pain. All right, and then do your exercise, take fruits, and of course see your doctor. And I trust that as we mark another World Kidney Day, God will preserve us and help us to maintain these things and live a healthier life. Thank you very much, and God bless.
Thank you for listening to today's episode of Sagelife Health Podcast. Stay tuned for our next episode. I hope you found this episode quite interesting, educative, and informative. And do not forget to follow us on all our social media platforms. See you next time.